"Just a nurse," he said. That's what Dr. Martin Caldwell called her when she passed him in the corridor outside room for 47, his voice carrying the particular contempt of a man who'd never had to hide who he was. Katie Rodriguez didn't flinch. She kept walking, her badge clipped to the pocket of her scrubs, her hand steady as they pushed the medication cart down the fluorescent-lit hallway of Seattle General's ICU. Nobody knew. After 3 years, nobody at this hospital knew anything real about her. That was the arrangement. That was the deal she'd made with the Pentagon when they buried Major Katie Rodriguez in a convoy attack that never happened, when they told her to become someone else, someone disposable, someone forgettable. They didn't know they were standing next to a legend. And what happened next would prove exactly how dangerous it was when one person, just one, decided to pay attention. The night shift at Seattle General began at 10:47 p.m., that liminal time when the day nurses finished their handoff reports and the fluorescent lights hummed their nocturnal frequency. Katie arrived with coffee from the break room, the acrid smell cutting through the antiseptic tang of the ICU, and she settled into the routine that had sustained her for 3 years: vital signs, medication checks, the soft mechanical breathing of 12 ventilators in synchronized rhythm. Room for 47 was at the end of the corridor, its door slightly ajar the way she always left it. Inside, the monitors beeped their lonely song. Marine Commander James Kellerman lay motionless on the hospital bed, his left arm positioned at a 45-degree angle, his right leg supported by a pillow under the calf. 3 years. 1,095 days without waking, his Glasgow Coma scale score frozen at a 5, his chart documenting neural deterioration despite every standard protocol the hospital's neurology department could prescribe. Katie closed the door behind her and stood at the foot of his bed, watching the rise and fall of his chest as the ventilator did the work his lungs could no longer manage. She'd read his chart so many times she could recite it backward: admitted from a tactical vehicle rollover in Virginia Beach, extensive head trauma, diffuse axonal injury, brainstem contusion, 17 surgeries, 0 improvement. The hospital had stopped documenting hope somewhere around month 8. But Katie saw something different when she looked at him. She saw a 6-year-old boy pulling himself from the rubble of a collapsed building, blood covering his face, his eyes still somehow focused enough to find her in the smoke and chaos of Tikrit. She saw the moment his small hand grabbed her wrist, the weight of his body as she carried him through a firefight that lasted 11 hours. She saw the scar on his shoulder, the exact same scar now visible on the man lying before her, where shrapnel had entered and exited, where she'd applied a field dressing made from MRE packaging and the stub of an old trauma needle. Katie reached out and traced the scar with one finger, her touch so light it barely disturbed the hair on his shoulder. Her hands moved with the muscle memory of someone who'd done this in a tactical field hospital, pressure bandages and triage and decisions that meant life or death. The scar formed a specific pattern: entry wound 2 centimeters below his clavicle, exit wound 3 centimeters down the posterior side. No two scars are identical. She'd bandaged this one in person 20 years ago, her hands operating under the kind of pressure that rewires your nervous system forever. She performed the range of motion exercises she'd been trained to do in her previous life, rotating his shoulder joint with deliberate precision, each movement designed to prevent the muscular atrophy that came with coma. She whispered to him in Arabic, the same phrases she'd used when he was a child: "Stay with me. You're going to be okay. I've got you." The words came back to her without effort. Some languages never leave your body. Some memories live in your hands instead of your mind. The door opened without warning. Katie didn't jump. Her hands continued their movement, smooth and practiced, as if she'd been performing routine physical therapy the entire time. Dr. Martin Caldwell stepped into the room, his white coat catching the overhead light, his eyes moving from Katie's face to her hands to the commander's shoulder. He was tall in the way of men who expected doors to open before they reached them, with the kind of angular features that suggested old money and boarding schools. His presence made the air pressure change, the way it does when an apex predator enters a room full of prey who don't yet understand the danger they're in. "Night nurse," he said, his voice like a tank idling in a garage, all quiet threat. "I don't recall authorizing physical therapy protocols for this patient." Katie's hand dropped to her sides. She turned to face him with a composure that came from having already survived worse than this moment. Routine range of motion. Prevents contractures. At 2 in the morning. He stepped closer, his eyes tracking the details of her face, searching for something specific. That's not routine. That's devotion. It's care, Katie said. Her voice had dropped an octave, stripped of inflection. She moved toward the door with the careful efficiency of someone who'd learned to navigate hostile spaces without telegraphing her intentions. I'll stop if you prefer. But Caldwell wasn't finished. His gaze followed her to the door, and as she reached past him to step into the corridor, her jacket pulled open, just slightly, a fraction of an inch, when he saw it. The faded unit patch sewn into the jacket's interior lining, positioned so close to her heart it could have been a secret she'd been keeping next to her skin. A Marine Corps emblem, desert tan colors, gold lettering that read Ghostbird 2003, the year embroidered below in military stitching. His entire body stilled. His eyes locked on the patch for exactly 2 seconds before Katie's hand closed the jacket, her movements controlled and deliberate, the way you'd contain classified material if it suddenly exposed itself in a public place. The silence lasted exactly 3 seconds. Then Caldwell stepped back, and Katie watched understanding bloom across his face like a flower opening in time-lapse. He'd seen something. Not everything, but enough. He'd seen the unit designation. He'd seen that it was classified, only a person with specific security clearance even knew the Ghostbird designation existed. He'd seen the year. And he'd connected the dots between a Marine operation that was officially erased from every database, a unit that didn't exist, and a woman he'd written off as a forgettable night nurse working a forgettable shift in a forgettable regional hospital. "I'll need your personnel file," Caldwell said quietly. It wasn't a request. It was a command, delivered with the confidence of someone who'd already begun calculating how to use this information, how to weaponize it, how to turn whatever she was hiding into a problem he could control. "We'll need to review your credentials more thoroughly. Perhaps a reassignment to ensure proper supervision." Katie met his gaze. She didn't speak. She didn't defend herself or explain or lie. She simply held his eyes for 2 full seconds, letting him see exactly how little she feared whatever came next, and then she walked past him into the corridor. Behind her, she heard him breathe out slowly, the sound of a man realizing he'd just discovered something that made his position simultaneously more powerful and infinitely more dangerous. What happened next would end careers. Dr. Caldwell's campaign began the moment Katie closed the examination room door behind her. It wasn't dramatic. It wasn't loud. It was surgical. The first move came on a Tuesday morning when the ICU staffing sheet rotated. Martinez and Chen, the 2 night nurses who'd worked alongside Katie for 18 months, who understood her clinical instincts, who didn't question her assessment of the commander's baseline vitals, were reassigned to the cardiac unit effective immediately. Their replacements were fresh out of orientation, eager to please, quick to defer to any physician's authority. Caldwell smiled when he announced it during rounds. Katie read the new assignment posted outside the supervisor's office and felt the first cold tightness in her chest. This was institutional power being wielded with precision. This was a man who understood how to isolate a target. The rotating shifts came next. Katie's schedule, which had been consistent for 3 years, Monday through Thursday, 7 p.m. to 7 a.m., suddenly fragmented. Mondays off. Then Tuesday nights. Then a double shift followed by a 48-hour gap. The stated reason, in the memo circulated by the nursing supervisor with Caldwell's signature at the bottom, cited a continuity of care concerns and equitable distribution of experienced staff. The actual effect was that Katie spent 17 days over the next 4 weeks away from the commander's room. Other nurses rotated through, charting vitals, adjusting medications, performing the routine care that kept him alive. Katie, when she did return, found gaps in the documentation, inconsistencies in notation, details that suggested no one was watching him the way she had been, looking for the small fluctuations that meant something deeper was stirring behind his closed eyes. She requested, in writing, to maintain primary assignment. Caldwell scheduled a meeting in the physician's lounge with 4 other doctors present. Witnesses. A strategy. He waited until she sat down, then began speaking before she could present her case. Nurse Rodriguez, he said, his voice carrying the careful diction of a man creating a record, your attachment to this particular patient is becoming concerning. I'm wondering if perhaps the stress of 3 years in critical care has begun to affect your professional judgment. He let that hang in the air. The other physicians shifted in their seats, uncomfortable but complicit. You've confused yourself with someone who participates in treatment decisions. You're here to execute them. Nothing more. Katie took one measured breath. Her hands remained folded in her lap. She said nothing, which was exactly what Caldwell wanted. He could report her as insubordinate, or passive-aggressive, or emotionally unstable. Silence could be weaponized. She understood this. She'd studied this tactic in briefing rooms 15 years ago when learning how to survive interrogation. Stay composed. Don't react. Let them interpret your silence as guilt. But the real humiliation came 2 weeks later. The commander's room was quiet that afternoon, machines humming their mechanical rhythm, the ventilator cycling with its soft hiss and release. Katie had been performing gentle passive range of motion exercises on his atrophied legs, not part of the official treatment plan, but basic physiotherapy that kept muscle from deteriorating completely, that maintained neural pathways even if the conscious mind wasn't receiving the signals. It was something she'd learned 20 years ago in Tikrit, when you worked with trauma victims and understood that the body could heal even when the mind was locked away. 3 minutes of gentle flexion and extension. Twice a day. The medical literature supported it, but more importantly, Katie had seen it work. Caldwell appeared in the doorway with the precision of a hunter who'd been waiting for exactly this moment. 3 nurses clustered behind him in the hallway, younger staff, new to the unit, still forming their allegiances. Nurse Rodriguez, step away from my patient immediately. His voice was loud. Controlled. The voice of a man speaking for an audience. These unauthorized physical therapy techniques are not only outside your scope of practice, they border on malpractice. The commander's parents were visiting. They stood near the window, the mother gripping a coffee cup, the father with his hand on her shoulder. Caldwell turned to them with an expression of practiced concern. Mr. and Mrs. Kellerman, I sincerely apologize that you've had to witness this overreach. Rest assured, I will be addressing this with the nursing administration immediately. Your son's care is far too important to be compromised by our enthusiasm. Katie straightened, wiped her hands on her scrubs, a small gesture, unrehearsed and perfect. She met Caldwell's eyes. In that moment, something shifted in her posture, microscopic but present. The way a soldier stands when they've taken their last order from someone without authority. One tear escaped down her cheek. She wiped it away without breaking eye contact. Her voice, when she spoke, dropped to a register that made the younger nurses in the hallway step backward. I've seen men with more courage bleed out in the sand than you'll ever have standing in this clean room. The silence lasted exactly 3 seconds. Caldwell's smile was thin and venomous. Insubordination noted. We'll be discussing this with HR. The break room became a map of her isolation. By the next shift, Katie understood the new topology. She sat at the corner table, the one nearest the supply closet, the one no one chose. When she arrived at the coffee station, conversation stopped mid-sentence. Colleagues gathered their cups and left when she approached, dispersing like water around a stone. By week 3 of the rotation, she ate her meals alone while watching the rest of the night shift cluster at the opposite end of the room, their voices dropping to whispers when she passed the doorway. The other nurses had made their choice. Caldwell controlled the schedules. Caldwell controlled the evaluations. Caldwell was a physician, which meant he was management. Katie was a nurse with no allies and a file growing thicker with documented concerns about her judgment. The final humiliation came on a Thursday morning, 3 minutes before shift change. Katie approached the nursing station to review the day's schedule, and her eyes fell on the public write-up board. The board where vacation requests were posted, where commendations were announced, where staffing changes were communicated. There, in red ink, next to the name Rodriguez, K. Written warning for overstepping clinical boundaries. Patient attachment concerns. Unauthorized treatment protocols. Every person on the unit would read it. Every doctor making rounds would see it. Every family member asking about her would be directed to a nurse whose judgment had been officially questioned. She read it standing at the counter, the paper trembling very slightly in her hands, not from fear, but from the effort of restraint, the muscular control required to keep from tearing the board from the wall and hurling it across the room. She placed the copy carefully in the recycling bin, smoothed her scrubs, and returned to her rounds with her face perfectly composed. That afternoon, Dr. Caldwell stood beside that same board during physician rounds, discussing case notes while his finger lingered near her name. A gesture. A reminder. A way of saying, everyone knows. Everyone is watching. You're finished. But that wasn't the worst part. That evening, Katie discovered that Caldwell had CC'd the entire nursing board on a formal email to the hospital administrator. The subject line, staff transfer request, critical care to pediatrics. The language was clinical and damning. She's clearly burned out on critical care. Perhaps she needs a change of pace before someone gets hurt. Recommend immediate reassignment for patient safety and staff morale. The email somehow ended up printed and left in the break room, not an accident, never an accident, positioned where every nurse would see it on their way to their shift. Katie read it standing at the counter, the fluorescent lights humming their electric drone overhead. She placed the paper in recycling, returned to charting, and didn't allow her breathing to change. Caldwell had moved from isolation to institutional erasure. He wasn't just removing her from the commander's care anymore. He was removing her from critical care entirely. He was burying her in a different kind of sand, one made of bureaucratic paper and professional death. She had no idea that Caldwell had already received a phone call from the Pentagon liaison, a woman whose voice carried the weight of classified authority. Certain operations in Tikrit were closed. Certain personnel associated with those operations were security concerns. If Caldwell happened to encounter any individuals claiming connection to those operations, his obligation was to report up the chain. The liaison had been very polite. Very clear. Caldwell had seen the unit patch. He'd made the calls. And now he understood that isolating Katie Rodriguez wasn't just about hospital politics. It was about something far larger, something that required him to be meticulous, methodical, and completely deniable. She only knew that every door was closing. She only knew that the boy she'd pulled from burning rubble 20 years ago was trapped behind those doors. And she had less than 48 hours before the transfer request was approved and she was reassigned to a pediatric unit 3 floors above, where she'd never see Commander Kellerman again. The commander's brain scans told stories that 3 years of standard protocols had missed. Katie sat alone in the imaging archive at 11:44 p.m., the fluorescent glow casting her face in pale blue light, scrolling through the digital files she'd accessed during her final authorized chart review. The patterns were there, subtle electromagnetic fluctuations in the temporal lobe and Broca's area, the language centers, spiking at intervals that didn't match the standard sleep-wake cycle. They spiked at night. They spiked when she was in the room. The data wasn't random. It was responsive. She enlarged the scan from 3 weeks ago, then 6 weeks, then 8. The progression was undeniable. The neural activity in the motor cortex, the region controlling voluntary movement, showed measurable increases in amplitude correlating directly with her voice during those early morning hours when the ventilator's rhythm was the only soundtrack to the silent ward. She wasn't imagining the finger twitch. It was there in the data, recorded, quantifiable, as real as the calluses on her hands. The commander's unconscious mind was listening. It was tracking. It was fighting its way back toward consciousness through the darkness. Every official therapy protocol called for passive range of motion, standard compression, automated pressure relief. Standard care for a patient expected to remain a permanent fixture in ICU bed 8. But the data suggested something else entirely, that auditory input, specifically vocal input, was triggering measurable neurological response in a patient who should have been generating nothing but flat baseline activity. The medical literature called it coma emergence. The protocols called it dangerous false hope. Katie called it a lifeline that no attending physician was willing to reach for because reaching meant acknowledging that the patient might actually want to come back. She closed the files and deleted her access history with the practiced efficiency of someone accustomed to leaving no digital footprints. Then she walked back to the ICU wing, past the nursing station where the night supervisor was charting, and into the darkened room where Commander Kellerman lay beneath layers of white cotton and sterile restraints, his chest rising and falling with the mechanical precision of the ventilator keeping him tethered to the living world. Katie pulled a chair close to the bed, the same chair she'd occupied during 1,000 previous shifts, but tonight it felt different, heavier with purpose. She didn't touch him. She didn't adjust his lines or check his pupils or perform any of the dozen clinical tasks that would justify her presence on the monitor logs. She simply sat and spoke, her voice dropping to something beneath a whisper, words meant for ears that everyone else insisted couldn't hear. "It's Katie," she said, using her first name deliberately, knowing it would register differently in his neural pathways than titles or protocols. "You're at Seattle General, Norfolk. The commander's going to be okay. You're strong. The strongest person I've ever known. You remember Tikrit?" The words came out measured, intentional, each one placed like a stone in a path she was building through the darkness of his unconscious mind. "You remember what you did there? What we did? That's inside you still. That's still in there fighting. I can see it fighting." She continued speaking for 18 minutes, tracking the subtle changes in his cardiac rhythm, the minute increases in his oxygen saturation that coincided with specific memories, specific names, specific moments of valor that she was pulling from the deep places where they'd been buried. She was speaking in code, in references that only someone who'd been there would understand, and she was watching the data respond, the heart rate climbing from 62 to 68 to 74, the oxygen saturation holding steady at 96, higher than it should have been during sleep cycle, responsive to stimuli, responsive to her voice calling him back. She did it again the next night, and the night after that. By the fourth unauthorized therapy session, the pattern was unmistakable. The commander's neurological markers showed consistent improvement during the hours Katie was present. The improvement reversed when she left. The data was becoming impossible to ignore for anyone who actually looked at it with clinical eyes rather than professional dismissal. Dr. Caldwell looked at it. He accessed the commander's chart during morning rounds on a Thursday, reviewed the most recent brain imaging himself, and pulled the night nursing logs. He saw Katie's badge swipes, the precise times of her visits, the correlation between her presence and neurological improvement. He saw the handwritten notes she'd left buried in the chart, not official entries that would appear on her nursing record, but personal observations about responsiveness, about emerging awareness, about a patient who was fighting his way back and needed someone to listen. The phone call Caldwell made that afternoon went to the Washington State Nursing Board. The voice on the other end, a board administrator named Patricia, had spoken to him twice before about staff complaints at Seattle General. This time, his tone was different. Concerned. Professional. Troubled. "I'm calling in reference to Nurse Katie Rodriguez," Caldwell said, his words measured and clinical. "She's been performing unauthorized therapeutic interventions on a patient under my care. Specifically, she's been entering his room during evening shifts and engaging in extended verbal stimulation sessions that have no medical basis and violate our clinical protocols for comatose patient care." He paused, letting the implication settle. "I have concerns about inappropriate attachment. The patient is a Marine, decorated officer. She's expressing unusual interest in his case, beyond what's clinically appropriate. I've documented everything." Patricia took notes. Asked questions. Listened while Caldwell explained that he'd tried to address this internally, that he'd reassigned staff, adjusted her schedule, attempted to redirect her to different units, all to no avail. He mentioned the incident with the patient's parents, the inappropriate physical therapy techniques, the way she'd ignored his direct instructions. He mentioned that her personnel file showed a sudden shift in her employment 3 years ago when she'd appeared at Seattle General with no prior work history, no references, no explanation for the gap in her background. "That's unusual," Patricia had agreed. "It is," Caldwell confirmed. "Combined with her current behavior, I'm concerned about her mental state, her judgment, her fitness to practice nursing in Washington. I thought the board should be aware before something more serious happens." The complaint was filed that same day, stamped with an official seal, and routed to the Investigative Division of the Washington State Department of Health. It cited boundary violations, unauthorized treatment protocols, and potential risk to patient welfare. Caldwell attached copies of the write-ups, the incident report from the hallway confrontation, the email trails documenting Katie's resistance to his directives. He included a letter to the hospital administrator expressing his concern that Katie's license should be suspended pending investigation, that her presence posed a liability risk to Seattle General. Katie received notification on Friday morning. She was leaving her apartment for an evening shift when her phone rang, an unfamiliar number that identified itself as the State Nursing Board Investigative Division. The woman on the other end, Patricia, the same administrator who'd listened to Caldwell's concerns, explained that a formal complaint had been filed. An investigation would commence. Pending that investigation, her nursing license was placed on immediate temporary suspension. She was not to practice nursing. She was not to enter the hospital in her capacity as a nurse. She was not to access patient records or patient care areas. A formal hearing would be scheduled within 30 days. "Do you understand?" Patricia asked. Katie understood. She understood exactly what Caldwell had done, not a direct attack, but a surgical one, executed through official channels, weaponizing the very systems designed to protect patients against someone who'd been trying to save one. She understood that by raising legitimate questions about her background, he'd forced the state to look at the very things she'd been ordered to hide. She understood that her cover, built painstakingly over 3 years of perfect compliance and anonymous service, was unraveling. She pulled her car to the curb 3 blocks from her apartment and sat with her hands gripping the steering wheel, her jaw clenched so tightly she could feel her molars grinding against each other. The trembling started in her shoulders, a fine vibration like she was cold, except she wasn't cold, she was furious, and the fury had nowhere to go except inward, where it built pressure against the walls of her composure like water behind a dam. She allowed herself 60 seconds of it, 60 seconds where her breath came in short, sharp bursts and her knuckles went white against the leather wheel, and then she forced the pressure back down, locked it away, returned her hands to rest position. She could not go to the hospital. She could not see the commander. She could not continue the only work that had made her feel alive in 3 years, the only thing that had convinced her that her past had some purpose beyond the classified files and the redacted reports. Caldwell had severed her access with the same precision a surgeon used to isolate a tumor, methodical, professional, leaving no evidence of malice, just the clean removal of threat. Her phone sat on the passenger seat, the call from the State Nursing Board still active in recent calls. She reached for it, intending to delete the number, and then stopped. Her hands were shaking. Not from fear. From the knowledge that Caldwell had moved beyond strategy into sabotage, that he'd weaponized her own hidden identity against her, that the Pentagon's order to disappear had made her defenseless against someone who'd discovered her and decided she was dangerous. And somewhere in the hospital, in ICU bed 8, the boy she'd pulled from burning rubble 20 years ago was continuing to fight his way back to consciousness, alone now, without the voice calling to him through the darkness, because she'd been forced to abandon him. She started the car and drove toward the coast instead of the hospital, toward the rain that was beginning to fall, the sky turning gray and heavy with the promise of a storm. She couldn't go to work. She couldn't access patient files. She couldn't continue her unauthorized therapy sessions. But Caldwell hadn't revoked her credentials as a human being, and he hadn't suspended her right to come back later, in whatever way necessary, by whatever means remained available. The code alarm sounded at 2:53 a.m., the monitor's shriek cutting through the hospital's exhausted silence like a blade finding bone. Katie was 3 doors down, technically off his case now, suspended from any patient contact, but her body moved before her mind could stop it. Commander Kellerman's oxygen saturation plummeting. 88. 82. 75. She pushed past the junior nurse frozen in the doorway, already reading the clinical picture in 2 seconds, cyanotic lips, stridor breathing, the characteristic whistling wheeze of a collapsing airway. The previous surgeon had missed scar tissue. Months of gradual deterioration. Tonight it gave way completely. 90 seconds. That was all he had before his brain began to die from oxygen starvation. The crash cart was 30 seconds away. The attending physician was being paged. There was no time for protocol, no time for authorization, no time for anything except what her hands already knew how to do. Katie grabbed a ballpoint pen from the bedside table, her movements precise and economical, the way combat saves your life by eliminating wasted motion. She yanked it apart with her teeth, the plastic casing splitting. She seized the plastic wrapper from a hospital meal tray still sitting on the mobile table, the kind that had held his untouched dinner hours earlier. 20 seconds had passed. 70 left. Her fingers found the cricothyroid membrane, that small depression in the throat between the thyroid and cricoid cartilage, and the pen's hollow barrel became an airway, a lifeline, a decision to burn every bridge she'd spent 20 years building. The incision was swift and certain. No hesitation. No trembling. Just the muscle memory of a woman who'd performed field medicine under mortar fire in a collapsed building in Tikrit while blood pooled around her knees and rounds impacted the concrete above her head. The makeshift airway went in. The commander gasped his first breath through the pen's hollow core. "Get me a bag valve mask." "Now," Katie barked, her voice carrying the command authority of someone accustomed to being obeyed by people trained in weapons and tactics. 3 residents who had rushed into the room jumped to follow orders from a suspended nurse because her tone suggested the alternative was not an option. "You, stabilize his head." "You, get me a proper airway kit from anesthesia supplies." "You, cardiac monitoring, I need to see if there's been any arrhythmia from hypoxia." She maintained the improvised airway with hands that didn't shake, performed a chest assessment with the systematic efficiency of someone who'd done this in rubble and darkness with only the sound of gunfire for guidance. Breath sounds bilateral. No pneumothorax. No tension. Good. She called out orders in the clipped cadence of military medicine, direct, economical, leaving no room for confusion or delay. For 90 seconds she kept the Marine commander alive with a ballpoint pen and plastic wrap while the medical team scrambled to catch up to what she'd already done. Dr. Caldwell arrived 6 minutes later, emerging from the stairwell with his face already flushed with rage. He took in the scene in one glance, Katie's hand still on the improvised airway, blood staining her scrubs, 3 residents moving with the synchronized precision of people following a command authority they recognized. His expression shifted through something like shock before settling into cold fury. "Nurse Rodriguez, step away from the patient immediately," he said, his voice tight and controlled, the way powerful men speak when they're about to demonstrate their power. "Security! Remove her from this room." 2 security guards appeared in the doorway, uncomfortable but obedient, the kind of men who didn't ask questions about hospital hierarchy. Katie stepped back, her scrubs stained with blood, and met Caldwell's eyes with that same devastating calm she'd learned in the Pentagon's debriefing rooms, the one that came from having survived being buried alive. "His breathing," she said quietly. "That's all that matters." Caldwell's smile was arctic. "You just performed a surgical procedure without authorization, without supervision, without sterile implements, on a patient you weren't assigned to touch. That's not heroism. That's grounds for immediate termination and license revocation." He turned to the security guards. "Escort her from the hospital. Now." By sunset, Katie's nursing license was suspended pending investigation by the state nursing board. Her badge was deactivated. Security had emptied her locker while she watched from the parking lot, her belongings sealed in a cardboard box like evidence. Dr. Caldwell had made careful phone calls, she could see it in the formal letters that arrived at her apartment by 8 p.m. One to the state board, one to the hospital's legal department, one to his contact at the medical staffing company that handled placements across the Pacific Northwest. His methodology was surgical, each cut designed to excise her completely from the hospital system before anyone could ask why a night nurse performed field surgery with the precision of someone trained by the Marine Corps. The message was embedded in the careful language: she had overstepped. She had acted outside her scope. She had shown poor judgment and unprofessional attachment to a patient. By morning, 3 hospitals had quietly withdrawn pending job offers. By evening, her name was flagged in the state licensing database. By the next morning, the staffing company had circulated a memo about her termination, carefully worded to imply instability without stating it directly. Caldwell hadn't needed to tell anyone who she was. He'd simply made sure no one would hire her. 3 days later, Katie stood in the rain at her late husband's grave, the grass turning to mud under her boots, the cemetery empty except for the sound of water hammering the stone monuments. She'd come here after the suspension letter arrived, after the staffing company's rejection, after seeing Commander Kellerman wheeled to emergency surgery, alive, breathing, because she'd broken every rule. She pressed her palm against the gravestone, cold and wet and unforgiving. "I failed," she whispered to the stone. "I couldn't stay hidden. I couldn't save him without exposing myself. I couldn't be the ghost they ordered me to become." The rain ran down her face, or maybe it was tears, or maybe there was no difference anymore. "I'm sorry, Michael. I'm so sorry." The stone said nothing. The rain kept falling. Somewhere in Seattle General's ICU, the commander was waking up to a world that didn't know his rescuer was standing in the rain at a dead man's grave, having just sacrificed everything to keep him alive the second time. But that wasn't the worst part. The worst part was that Dr. Caldwell had won. The worst part was that she was about to disappear again, this time from choice, because exposure meant danger not just to herself but to an operation so classified that speaking its name out loud was a federal crime. The worst part was that the boy she'd pulled from rubble in Tikrit would never know why his savior had vanished from his life a second time, erased like the first phantom in her back, leaving only questions and the faint scar of a memory that couldn't quite hold a face. Katie stood in the rain for another hour, hands buried in her jacket pockets, feeling the outline of the one thing Caldwell hadn't been able to take, the faded unit patch sewn into the lining, the patch that connected her to an operation the Pentagon had buried, to a woman named Major Katie Rodriguez who was supposed to be dead, to a boy in a hospital bed who was alive because that ghost had chosen presence over oblivion. The rain hammered down like applause for a performance no one would ever acknowledge. The helicopter touched down on Seattle General's rooftop helipad at dawn, 3 days after Katie's termination letter arrived, the rotor wash hammering against the morning air like the percussion of an ending. 2 Marines in dress blues walked past security without hesitation, past the stunned faces of hospital staff, past Dr. Caldwell who emerged from the stairwell and tried to block them with bureaucratic authority. "Gentlemen, I'm not sure you have clearance," and they moved around him as if he were furniture. The lead Marine, a SEAL team leader with a face like carved granite and eyes that had seen classified things, asked the ICU nurse station with the precision of someone trained to find targets, "We're looking for Major Katie Rodriguez. Sometimes goes by her call sign, Ghost Bird. This is official business from the Commandant of the Marine Corps." The room went dead silent. The ICU nurses looked at each other, then toward Katie's locker, then at the SEAL, then back at each other in the suspended moment where reality shifted like tectonic plates. Katie stood in the medication room, her hand stilling over a supply cart, every muscle becoming stone. She didn't walk out. She didn't announce herself. She waited, letting the Marines come to her, because that's what soldiers do, they let authority find them when the moment arrives. The SEAL and his partner, a younger Marine with lieutenant's bars, walked into the medication room with the kind of calm purpose that made the fluorescent light seem suddenly insufficient. The SEAL saluted, a crisp fist to chest, and his voice dropped into the register reserved for giving orders in the dark. "Major Rodriguez. Your presence is requested by the Commandant." "It's not a request." Katie returned the salute with movements her body had memorized 2 decades ago, muscles remembering protocols her civilian life had tried to bury. "I'll need 5 minutes." "You have 3, the SEAL said. Not unkindly. Just factually." She changed in the locker room, trading scrubs for the dress uniform she'd kept in a waterproof bag since the day she'd walked out of the Pentagon debriefing, the uniform she'd been ordered never to wear again, the sleeves and chest waiting for the weight of medals that officially didn't exist. Her hands moved like a machine, muscle memory overriding hesitation, covers, ribbons, insignia, each piece a notation in a language she'd spoken before she'd learned to be a nurse. The uniform fit perfectly. It always does when you've worn it in your nightmares for 20 years. The Marines were waiting when she emerged. The SEAL's eyes tracked her in the way of someone assessing combat capability, and he nodded once, a gesture of profound recognition. They walked through the hospital corridors toward the ICU, past nurses who stopped mid-step, past residents who suddenly found their shoes interesting, past Dr. Caldwell who stood frozen in the hallway, his face draining like someone watching his own erasure in real time. The commander's family was waiting outside his room, his elderly mother, his father with military bearing that suggested his own service, his sister holding back tears. The mother's voice broke when she saw Katie in full dress uniform, the patches and medals catching the morning light, and she stepped forward with the urgency of someone who'd been holding a question for 3 years. "Major? You're the major?" "Yes, Katie said, and the word carried the weight of all the silence before it. The attending physician, Dr. Sarah Chen, was waiting inside the commander's room with a file in her hands. She'd kept careful records, documentation of everything Dr. Caldwell had tried to bury, and she placed the file into Katie's trembling hands, and yes, they trembled, but only there, only in the privacy of this moment, only where someone who understood combat medicine would recognize it as the tremor of decompression, not fear. The file documented measurable neurological response during Katie's unauthorized therapy sessions. Brain activity returning. Neural pathways lighting up. And then, 3 weeks ago, the first words from the commander as his consciousness clawed back toward the surface: "Ghost bird. Tikrit. She pulled me out." Katie closed her eyes. The room tilted slightly, then steadied. The SEAL moved beside her and placed one hand on her shoulder, the contact grounding. "Major Katie Rodriguez," he said, loud enough for the family and Dr. Chen and the gathered staff to hear clearly. "Navy Cross. 2 silver stars. Purple Heart. Disappeared after holding a position for 11 hours to extract 73 civilians, including one 6-year-old Iraqi boy." He paused, letting each statement settle like stones in still water. "The commandant has read your file. The entire file. The one that was supposed to be sealed." His eyes found Dr. Caldwell in the hallway. "We found some interesting anomalies in the hospital's security system." That was the signal for Danny Torres, the Marine veteran who worked in IT, to step forward. He'd spent 6 weeks rebuilding deletion threads, recovering overwritten footage, reconstructing the digital grave Caldwell had tried to dig. He stood with his laptop and a portable drive, and when the FBI agent arrived, the appointment made with calls the SEAL had placed at 3 in the morning, Danny showed her the preserved footage. Caldwell entering the medication dispensary at 2:53 a.m. Caldwell accessing the commander's phone lines without documentation. Caldwell's hands moving with the precision of someone who knew exactly which medications to substitute, which dosages to falsify. 18 months of footage. 73 separate incidents. All the evidence pointing toward intentional sabotage designed to ensure the commander never woke up while Katie Rodriguez was still his nurse. The FBI agent's face hardened with the particular fury of someone realizing she was looking at premeditated harm. She had Caldwell detained within the hour. Over the next 3 weeks, the investigation unraveled with surgical precision. The State Medical Board reviewed his falsified incident reports, the backdated complaints, the witness statements from nurses he'd intimidated into silence. The hospital's legal team found the kickback scheme with the private staffing company, payments flowing from Caldwell's consulting contracts in exchange for patient referrals, a federal offense that added another layer of culpability. The pharmacy discovered the missing medications that corresponded exactly with his access logs. His meticulous documentation, the notes he'd kept thinking they'd protect him, instead became the map of his own destruction. Each email was screenshot. Each phone call was reconstructed from call logs. Each policy decision was revealed as deliberate sabotage disguised as professional concern. Dr. Martin Caldwell's medical license was revoked in Washington, California, and New York. Criminal charges were filed for evidence tampering, obstruction of justice, and potentially attempted murder. The prosecution would need to establish intent, and they had it in abundance. His face appeared in legal journals. His name became shorthand for what happens when institutional power is weaponized against someone with no authority to fight back. His marriage dissolved when his wife realized he'd been using hospital access to hide financial crimes. His waterfront home went into foreclosure. The colleagues who'd deferred to him, who'd allowed him to orchestrate Katie's exile, suddenly couldn't remember ever supporting him. 5 months later, Katie walked through the main entrance of Seattle General on a Wednesday afternoon, not as a dismissed employee but as something else entirely. She passed the parking lot where Dr. Caldwell sat at a folding table beside a chain pharmacy, his dress shirt rumpled, his face carrying the permanent slump of diminishment. Supplemental insurance policies lay stacked in front of him, his job a punishment assigned by whatever employment agency had taken pity on him. People who approached his table for coverage wouldn't meet his eyes. He looked up as Katie passed, recognition flickering across his face along with shame so complete it was almost pitiable, and then he looked down at his paperwork, trying to erase himself through simple failure to acknowledge. Katie didn't break stride. Commander James Kellerman was in the physical therapy wing, standing with a walker, his muscles rebuilding after 3 years of atrophy. His hands trembled with exertion but also with the tremor of pure determination. He'd been told he'd never walk again, and he was walking. His parents stood nearby, his mother with tears that had become permanent since the day she understood her son had woken up because a woman he didn't remember had chosen to break every protocol to reach him. When Katie entered, the commander's face shifted into something beyond recognition, something older and clearer, the 6-year-old boy's memory surfacing in a warrior's eyes, the ghost soldier becoming suddenly, impossibly real. He extended his hand with the grip strength of someone who'd been fighting for every fraction of recovery. Katie took it, and neither of them spoke because some contact transcends language. On the wall beside his hospital bed hung the faded unit patch, the one she'd sewn into his jacket 20 years ago in a compound in Tikrit. He'd carried it through 2 full deployments, kept it even when the military had buried the operation and erased her from official history. Beside it, framed carefully, was a photograph Katie had never seen, a woman in desert fatigues, face partially obscured by the haze of detonation, holding a small bleeding child against her chest while the sky ignited behind her. One hand pressing field dressing to the child's shoulder. One arm curved around his body in the shape of absolute protection. "That's you," the commander said, his voice still rough from the tracheostomy tube's long residence. "Isn't it?" "Yes," Katie said. "Just that. Just the truth, finally allowed to exist in daylight. I've dreamed about that moment for 20 years without knowing it was real. Without knowing your face, I knew I was safe because of you." He tightened his grip on her hand. "Thank you for not letting me stay dead." The nursing supervisor appeared in the doorway, hesitant in the presence of someone decorated with honors that belonged to classified history. She offered the position, return to the ICU, train the next generation, use the full spectrum of skills she'd been forced to conceal. Katie looked at the commander, at his parents, at the photograph of the ghost she'd been, and felt the weight of the last 3 years, the humiliation, the firing, the grave in the rain, settle into its proper context. Not erasure. Not punishment. Training. Preparation for this moment. On one condition, Katie said, her voice dropping into the register she'd learned in Tikrit, the register that made people listen. "I teach them that the quietest person in the room might be holding everything together, and you'll never know until you give them the chance to show you who they really are." The supervisor nodded. The commander smiled, relief and gratitude in the same expression. And Katie Rodriguez, Marine Major, combat medic, ghost, nurse, guardian, finally allowed the separation between her identities to collapse into something whole. If you haven't already, please subscribe to our channel and hit the notification bell so you don't miss stories like Katie's. Drop a comment below, what would you have done in Dr. Caldwell's position? And share this video with someone who needs to remember that the quietest warriors are often the most dangerous.